So I thought we'd have a bit of a chat about how we transition patients. So if you're under an osteopath and we've got a treatment plan and strategy, sometimes the patients, we do let them have time off sometimes, and I'm sometimes allowed to have time off. Sharon lets me go out occasionally. We can't always fit everybody in with the right practitioner, so we want to stay as best continuity as we can, but actually appointment times is far more important than actually the right practitioner. So what we've done is we generate a treatment plan and diagnosis to make sure that's really clear, and then that patient then can be handed on to another practitioner, and then they can bounce between practitioners and still get that sort of great outcome. So it's interesting to see what Von feels about how the transition occurs. So how do you feel it goes when we transition inside the clinic?
Oh, I mean, it's great, first of all, because like Alex said, we do treat patients more or less the same way with very similar techniques. So, of course, all the time we'll get a really good treatment plan from the previous practitioner. Luckily, practitioners here are pretty good.
Yeah, I hope so. We train them hard.
Exactly.
And that training process is really important, because if we can get continuity in training, continuity in technique, continuity in diagnosis and treatment strategies, then we're all on the same page.
Exactly, we're on the same page, so you're just kind of picking up where they left off, quite literally. And as well, since you're a second pair of eyes, you can add things to it and complement as well, because at the end of the day, you could be seeing some things that they might be missing. So it's a win-win, really.
And we finish off each other's sentences as well, which is quite interesting. I was interrupting him there. So it's really important that we can always add something. So a fresh pair of eyes can often add a little bit more than the last practitioner, just a different slightly view, and go, oh, we could add that little bit or change that bit of advice, and actually that always helps keep it fresh. It keeps them going forward. We had a bit of a laugh because one of the patients was transitioning between Nathan and Yvonne to Nathan, and so, oh, well, they're like a pair of twins, you know, you can hardly tell the difference between them, but if you've ever been treated by them, there's slight physical characteristic changes you might not have noticed, but
basically nothing, honestly.
Yeah, hardly anything at all. But what they like about it is that the transition's so smooth, it's so fluid, and the patients can be picked up and then cared for, and then they continue to get those great outcomes. So if anyone gets transitioned in and out of practitioners, you'll understand that actually we do have a plan, actually we have an internal process to make sure those things go well for you. So take care, guys.